So if you're just tuning in, welcome to the R&D page. And today we are talking everything chronic pain. So I'm joined today by Divina, who is a therapist / counsellor based in Harrow. And essentially today we're going to go through chronic pain, talking about what chronic pain is and talking more about the psychological effects of chronic pain, to talk about anxieties, fears that you may face, and perhaps even share our own examples of clients that have walked through, and also go through tools that could be useful. So if you don't know me, my name's Jag. I'm a physio working at R&D Physio, and I'm also a coach and mindfulness teacher who likes to specialize in chronic pain, particularly. And I'm joined by Divina, who, if you're happy to introduce yourself.
Cool. So I'm Divina. I'm based in Harrow and I'm a person-centered therapist. I studied at the University of Nottingham and have recently opened up my own practice, but I've been kind of on and off placements for about 4 years now. So yeah.
Sweet. So I guess getting straight into it, we'll talk a bit about chronic pain. So those of you that don't know what chronic pain is and how that differs from pain in general, we refer to chronic pain as pain that lasts more than 12 weeks, and pain that doesn't last 12 weeks is referred to as acute pain. And essentially, it can be a physical feeling where you injured yourself and that pain lasts longer than 12 weeks. And common chronic pain include back pain. So we get a lot of patients that walk through with back pain. And what we tend to find is, although you have that physical pain, a lot of the patients, they come through and they have that emotional aspect where they feel anxious, they feel fearful, they have that avoidant behavior of certain movements. And as a physio, I try to get through to them and, try to speak to them, try to understand where they're coming from. But sometimes, especially if you've had pain for more than a year, more than 5 years, it can be really daunting and really emotional. And this is where it can be really useful to talk about the emotional pain, especially to a therapist or counselor who can go through different aspects of their pain and the different emotions and feelings they may be feeling.
Yeah, no, 100% agree with everything you're saying. Like, there is normally always a link between the physical aspect and the emotional aspect. And a lot of the time, because the physical is present, it's right there, you can see it, you feel it, it's right there. So a lot of people tap into that. However, the emotional stuff is so heavy, but it's just so difficult to tap into. It's not as easy, hence why people then just decide to avoid it and think, right, it's okay, I'll leave it on the side for a bit. But actually, you're right, there is a big correlation between those two.
100%. And I can imagine with your kind of expertise, you get a lot of patients that come in and they work more in the emotional aspect. From your kind of personal experiences, what kind of common things that you see and how do you kind of manage those things?
So one big one, like I said, was avoidance. A lot of the time they come in, they're like, right, so actually I feel this pain in my leg, or I feel this pain here, and they're very happy to discuss that. However, the avoidance part comes in when we tap into the emotional side of things and actually their past traumas that could have impacted the chronic pain. That's something that I see in a lot of my clients. It's just a no zone. It's very, very difficult to then get in touch with that side. And actually, I see loads of forms of anxiety, when they feel the need to then open up at that emotional side. It's really difficult. And depression is also very common because obviously chronic pain lasts a very long time. That comes all the emotional factors, which result in anxiety, depression, and actually past experiences, hence the trauma. Is very, very common, and actually there's a lot of deep-rooted things within that.
Cool. And like in terms of like those kind of anxieties and fears, like what do you feel is the best way to kind of navigate around that? Like, I know for someone who's experiencing that pain, what would you kind of guide them through? Like, is it more about understanding those emotions, or is it more about being able to understand, those are emotions, but that you don't necessarily have to react to them?
I think there's two things. One being actually very transparent about the pain that you are suffering in terms of physically. It's important to be able to tap into that, relate to that, and actually understand how that pain is impacting you emotionally as well as physically. But actually behind all of that, there's a lot of traumas that have gone on, or there's a lot of past experiences, negative experiences that have happened that are impacting the physical pain. So it's actually two kind of lots of feelings. The pain aspect of you know, for example, frustration is a huge one, feeling drained, feeling tired, all of those things, and looking at that, but then also looking at the fact that there's a lot of emotional stuff. So pain, hurt, upset, anger that could be kind of trapped within the body as well. So it's a form of release of looking at two different aspects in itself.
Yeah, cool. That's really interesting because I see patients, I think a particularly recent patient that I saw had chronic back pain since he was like 25, he's now in his 40s. And over the course of those years, you know, like you build up a lot of beliefs, a lot of feelings of like anger, resentment. And it's almost like if you don't, if you kind of repress them and you don't talk about them, it just gets more and more worse. And then
100%.
on top of that, you get like people telling you do this, do that, which can make it more and more confusing.
Yeah.
So like in terms of what are common feelings that you do kind of find, like anger is one, sadness is one.
Anger, 100%. Literally, the first one, anger is always the main surface level. I'm angry. And what are you angry towards? It could be the pain I'm so angry towards and frustrated towards this horrible pain that I've been suffering for such a long time. What can I do about it? It won't go away. But then actually underneath that, there's a lot of other feelings. That's always normally, surface level stuff. There's always a lot of upset, fear, anxiety, resentment, so many different things. And like you said as well, the more we kind of suppress it and hold it in for years and years and we bottle it up, it then turns into very, very different emotions, which then, you know, long-term effect wise are very, very difficult to kind of process, understand, especially when you're doing that on your own. And as well as that, people telling you, you know, do this, this will help, do that, that will help. It all just becomes super overwhelming. And I think that's the bit where you're like, right, I've got so much to do now. You know, there's so much that I can be doing, but actually it's very dependent on the person, what helps, what doesn't help. And that can also, you know, bring in the whole overwhelming thing or the anger or, you know, the frustration towards other people as well.
Yeah, definitely. I think you've highlighted a lot of points, and I think one point you said earlier is also the idea of like acceptance. So like if you don't accept, you have that kind of emotional aspect to it, you don't really move forward because you're always like just denying it and you're repressing it. How can someone kind of going through that kind of physical pain, how can he help them accept that they also have that emotional pain and that it can also be beneficial and that actually there's nothing wrong with seeking help?
Well, I think the big thing is actually, again, like I said, very much focused on, yes, you know, I've got, for example, I've got back pain. You can openly say that, but actually, can you say, you know, what you've been through, the trauma that you're suffering? Or a lot of the time, my clients actually don't know what's hurt them or upset them or where this trauma is stemmed from. And I think that's the biggest thing. So it's actually first acknowledging the pain emotionally, you know, where, and mentally as well, like where is that coming from? Is it something from childhood that's emotionally built up into a particular feeling, or is it something that's very, very new? Is it an alienated feeling? So I think the first thing, especially in therapy, that's, you know, helpful is actually to acknowledge what's happening for you in the here and now. How are you feeling? Yes, number one, towards the pain, but also towards life. You know, are you angry towards life? Is something come up that you really need to process? And again, processing is another thing within itself, because I think a lot of the time people go, like, how do I process that? What does processing even mean? And I think acknowledging the trauma or the emotion or whatever you're experiencing is not the number one thing, which can be really, really scary. You know, being in that chair, you know, counseling first time, you know, something that you've never experienced. You know, we've got the stigma around mental health, but actually it's the best thing that you could do for yourself, because you're releasing and you're letting go of that pain, anger, upset, that negativity basically.
Yeah, I think like acknowledging things is really important, because I was talking to some colleagues the other day and we were actually talking about how like sometimes patients come through and because they've experienced so much kind of like people like telling them do this, do that, you know, your back pain will get it if you start moving, if you start, go see a physio, go do some exercise, drink like lemon water, all these kind of remedies. And
Yeah.
home, especially with family, they don't acknowledge the pain that the patient's going through. So when they come to you like a physio, they kind of just want that acknowledgement saying, you know, your pain is normal, your pain is real. And I
Yeah.
guess like the next step to that would be going to see a therapist where they can kind of talk through that pain and that emotional aspect to it. Is there kind of any experience that you've had or like personal experience that you've had with pain that you can kind of talk about and kind of give an example of maybe a client or two?
So regarding my own personal pain, unfortunately, yes, a lot. And this is why I think you tap in like in a great way, because obviously I did attend physio and I think it was really, really beneficial for many reasons, but actually went to then therapy for myself to kind of think, right, I'm a therapist, but actually, do I need personal therapy for myself to grow? And actually, yes, I did. So one aspect is, again, the way you said common, something that's very common is back pain. So I have a spinal cord issue and also a slip disc at quite a young age, which was really, really, actually, I felt angry towards that and being able to accept that now. Because I'm so young and I was like, why do I have this? You know, it's kind of like the whole anger, why me? Like, why is it impacting me and nobody else kind of thing? So there was a lot of that. And then actually, I'm also diabetic. That came as a huge, huge shock for me. And I think as a lot of people who do have diabetes, you know, it's like, wow, gosh, okay, you know, there are so many life changes you have to make. So in terms of future goals that you can explore in therapy, that's really beneficial, you know, to be able to explore how you're feeling about the diabetes. How has that changed your life mentally, physically, even, you know, I gained a lot of weight. It was really different for me. So there are so many different things. And I think hence why I'm kind of saying, yes, the physio is great. It's the first thing, right? Because you notice the pain. So I get leg cramps in the middle of my sleep. I get the tummy aches. I get really, really bad headaches. In terms of my back, a lot of back pain, lower back pain. It's just ongoing all the time. So hence why the physio is great, because obviously they can help with exercises. They can help, you know, they're relatable. They can understand that, you know, these are things that you're experiencing physically, but then actually there's a whole new aspect to how are you feeling towards your diagnosis. That's something that you can explore in therapy. How are you feeling towards other people, you know, telling you to do this, this, and this? You know, it's the amount of, Divina, you need to exercise more. Oh, eat this many calories in a day. Oh, eat this instead of what you, and it's like, yeah, half of that stuff I actually know, but it's about implementing that into your life. How are you going to do that? And that is another thing that clients tend to kind of avoid, you know. Yeah, I know that medication is a good thing because I need to take it because it will help control my sugars, but actually, how does that impact you as a person? It's about accepting all that. It's about accepting your life and what's happened, as well as the physical stuff, exercises, you know, walking, whatever that is. Yeah.
Yeah, I think definitely, like you said, like when everyone's bombarding you with information, it can get really daunting and you're like, what do I do? Because you're like, yeah, that I can do A, B, C, D, E, but again, you have to implement it. And I think when you come to like when you're given so many solutions and you come to a physiotherapist, you want them to kind of deconstruct everything. Kind of like you have a scattered brain, right? And you want them to kind of make everything easier and simplified so that you can follow. So definitely I can see where you're coming from. And I think a lot of our clients are the same way. They have so much information about exercises, do this, don't do that. And I think it's important as a physio for me to be able to say, you know, do this movement, do that movement. And I think similarly for you, it's important for you to acknowledge the emotions and I guess be able to kind of like get their thoughts across and like separate them.
100%.
Is that what kind of like what you guys do?
Yeah, and I think it's very similar in both of what we kind of do, because you're saying, yes, I offer, you know, yeah, do physio, etc., but actually there's a lot of other stuff. Like you're saying, you have clients that come in and actually there's a lot of emotional stuff that they, you know, then offload onto you. And actually for me, it's the same aspect in, okay, yes, I need to be able to kind of relate and understand to that physical element, but actually also be able to kind of dive straight into the emotional aspect and actually how that's affecting them emotionally and mentally as well.
Yeah, definitely. I think another key point I want to do draw out is that you said slip disc, and a lot of clients that come through and they have the like MRI scans, slip disc, and actually like there's a lot of evidence showing that, you know, a lot of people do have slip discs, but it doesn't mean they can't return to their full function, they can't do their full activity, and that slip discs are quite common in the population. So you do have slip disc and you get told that kind of from a physio or a GP, that can be really daunting. And actually like we try and stay away from that because we want to try and simplify the terms and show people that actually you can train, you can do this, and a slip disc won't stop you from doing it.
Yeah, and I think that's actually so important, because the reason I say that is because when you go see professionals and you go to doctors and they kind of look at you and think, right, this is the information, you have a slip disc, and that's it. And it's like, okay, right, so what can I do now to help myself? Just walk, don't do anything too heavy. And it's like, right, so that obviously, as being diabetic as well, that means, right, so in terms of exercise, I have to be careful, I feel it on a daily basis. So actually it's important to know that, hence why going to physio is good, because then you can help, implement those exercises, your daily routines, improve in terms of like your physical side, which a lot of the time when you go to the doctor and just kind of given that piece of paper, it is really daunting and it is super scary. So yeah.
Definitely. And in terms of also one more thing, trauma.
Yeah.
So me, if you had told me trauma like 2-3 years ago, I would have been like, trauma is like a big term. Like, I'm not traumatized. I can't be traumatized. You know what I mean?
Yeah.
So like, I've come to the understanding that trauma, everyone experiences their own kind of way of trauma, like their own kind of trauma is relative for each person. So in that sense, like, what kind of simple kind of ideas of trauma that I've experienced, or like, and what kind of more severe terms of trauma, or is that even me describing trauma in that sense really bad? Do you know what I mean?
I think people describe trauma as like there's a big T, like there's a big element of trauma, and actually there's a small T, there's a small element of trauma. But I think that is very personal to you. So, trauma can be anything. People say, oh, that was really traumatizing. It could be an event that you witnessed. It could be anything. It could be a form of domestic violence that you've experienced yourself, or you've witnessed somebody else, in the household. It's so big. Car accident, etc., etc. Something that stays with you. It's something that is so big that you need to be able to process in a healthy environment, in a healthy way. And I think there's not really a way to describe it. And I think the reason that I kind of get stuck with that all the time is because a lot of clients I get come in are like, well, what's like, am I traumatized? Is this a form of trauma? And actually, what does that even mean? Because if it's impacted you in some form of way, that means it's just impacted you in a negative way or in a positive way. And I think it's just very dependent on the human being themselves. Do you value it as trauma? That's the way I would look at it. Is it something that's impacted you in a negative light, that stops you from doing things, that makes you, have nightmares, or even wet yourself, or hold that physical pain in a certain way, or in a certain area or part of your body? How has it impacted you? And I think that's kind of what trauma is. There's no kind of right or wrong way of saying that, I think.
Okay, cool. And in terms of like, I guess the Asian community, because we see a lot of them like come to us in Northwood, and
yeah,
there's a lot of stigma around seeking help for trauma, seeking help for the emotional side. What kind of advice would you give someone who's kind of going through kind of like sadness, anger, resentment, and they haven't come to fully accept the pain, but they want to kind of let go of that pain? How can you break that stigma of seeking help is actually good for them and can help them move forward and become more happy and more content?
Yeah, so the one thing you say like is that you get a lot of kind of the Asian community coming to you, right? Hence, because obviously you deal with the physical aspect, and a lot of the time when it's physical, you can see it. You see a limp, or you see you're in pain. People are like, wow, what's happened to you? Are you okay? But actually, when you're going through some form of mental health condition, or just a negative or a bad time, people don't, a lot of the time in the Asian community, it's just kind of like, whatever, it is what it is, you'll get over it, kind of thing. And I think actually that's a big one, because I work with a lot of Asian clients, and the first step is always the hardest. That's the way I look at it. You can go to friends, you can seek support from friends or family members, etc. But actually being able to express your feelings in a very open environment, in a freeing way, actually, by swearing, by talking about a family member that's really getting on your nerves, or whatever it is, it's actually really, really beneficial. And I think there is a stigma around it, and I think hopefully I would like to break that, break that stigma, and I think that's something that we would like to do. However, I think, like I said, first step is always the most difficult, and I think it's important to remember that the physical aspect and the emotional aspect should be level. It's one's not higher or lower than the other. They should both be looked at in the same way. And actually, the biggest step is also accepting that there is something up and you are feeling low. There's elements of low moods or whatever. But actually, it's very dependent on the person, because I think a lot of the time I get phone calls from people saying, right, so my sister's in a really bad place, and I'm like, unfortunately, I can't help with that, because that's then kind of going into her own space, and that's not healthy. So the person themselves have to take that huge, scary step for themselves. So yeah, it's not based around anybody else being able to push them and help them, which is really scary, I know, but yeah.
Yeah, I can imagine that, like, being a really scary thing, because essentially you're stepping into space, sharing everything you know about yourself, like you've hidden about yourself,
Yeah.
being vulnerable to someone you don't know, and essentially, it's a big step. It's a big step. So, but I guess at the same time, you want to acknowledge the fact that it's a step in the right direction.
100%. Yeah.
Really come to your point where like you don't want those emotions, you want to talk about those emotions, let them go. You have to take that big step, and I guess whenever you're ready you can take that step. Are there any tools or any kind of sources that you'd recommend to help with
So
that?
in terms of like therapy in itself,
Yeah.
there's a lot of mindfulness that goes on, and I think people kind of go, right, what is that? But actually, it's just about grounding yourself and being able to breathe and actually be in your own space and be content with it and be grounded. And I think that's just the best way of describing it. And I think another thing is when you kind of start your first session or whatever, it's kind of like, well, there's nothing wrong with me. I'm here, and here's what it is. But actually, so much comes out of that. I've had clients first few sessions nothing. They don't want to share. They're like, nothing's wrong with you, I'm okay. Or they tend to say, I'm fine, no, that's normal, that's okay. But actually further down the line it's like, well, no, that's really annoyed me, that's upset me. So I think in terms of tools in the therapy room, it's just about having a non-judgmental kind of environment, a safe environment where everything is confidential, just a space to kind of kick, scream, swear, be yourself, be open, and actually understand what you're going through, and understanding that actually everyone has problems. And I think a lot of the time people think, right, you see someone on social media, wow, their life is perfect, but actually in reality it's really not. There's so much going on for that person behind closed doors, and actually being anxious, having anxiety or having depression, these are all very, very common things that we all experience in our lives, regarding on like how old you are, what your gender is, or whatever that is. So I think in terms of tools, it's all just kind of going with the flow, not having any expectations of what comes out of it, and just being open-minded in the therapy room to try out new experiments, whether that be a bit of role play, or some exercises you can do in the room to ground yourself, to breathe, to then take away with you as well. So when you're at home, you fix it into a routine. You do it in the morning, you do it at night, or you do it when you feel the need to. There's no right or wrong, it's about you. So yeah.
Yeah, it's really interesting that point you made about social media as well. I think so many people are like worked up, like their life is perfect, their life is not perfect, but life is good, and that
Yeah.
if you push through the pain, like especially with workouts, people come with pain, and they're like, I can handle the pain, it's fine. I'll just do take paracetamol, take painkillers, and just walk through. But you're not fine, because you're basically compensating. You're trying to compensate with painkillers. You're trying to move through and really avoid those kind of the root cause of this pain.
100%.
So definitely, I think you raised a key point there, and also the fact with mindfulness. Again, like I use a lot of mindfulness in my sessions, and I find a lot of people, what they do is over the course of 2 to 3 weeks, they find that the pain is still, they might still be there, but they're able to kind of disassociate with those feelings of like anger, resentment, and kind of move through and do other activities like exercises, for example. So definitely, mindfulness can definitely help there too.
So you've seen like a pattern that when they do implement these into their life, that actually, even though the pain is still there, it kind of releases something, a form of emotion, or some kind of gauging and understanding towards what they are actually experiencing.
Yeah, 100%. Like their quality of life improves. So like, even like, for example, I had a patient, and even though he might still experience pain here and there, compared to 6 months ago where he was like really angry at life, why am I living, suicidal thoughts, anxiety, now he's able to work out, live his life, spend time with his children, family. Quality of life improved. He might have pain here and there, but he knows that that pain will be short. He can manage that pain, and then he can.
And I think that's the most important thing. It's about pain management, right? Which is like super important, because again, I had a client who had IBS, this was many years ago, and she noticed that actually she'd be constipated, which will then mean, the kind of tightness in the stomach, the pain in the stomach, feeling uncomfortable 24/7, which will then lead to headaches because she's overthinking, she's not sleeping. It all has an effect. It's like a domino effect. And I think she mentioned, she came to therapy, she's like, right, it took her a very long time to engage with these emotions, to relate to them, and actually sometimes even speak them out loud. But she said it was a form of letting go. It was letting go a certain kind of energy or element that was in, actually very apparent in her stomach. So again, we hold these thoughts, in our back, in our shoulders, or on our neck, which is really, really common, in our stomach, in our legs, everywhere, just depending on the type of trauma or the type of diagnosis or the type of pain, for example, in the situation. So yeah.
It's really interesting that, because we get a lot of patients with knee pain or back pain, and they're like, I don't know what's going on. And like, I ask them how they're doing in life, especially during COVID period. And people come in, and like the fear of death was so big. It was a lot of the patients' fear of like immobility, being stuck indoors, and having to live with basically all your thoughts, and especially if you're living alone. So a lot of my clients, when they had like back pain, and when you talk about their lives, they're like carrying a lot of kind of weight on their back, essentially.
Yeah.
Yeah, and just like doing a lot of things. So in that sense, yeah, I can see where you're coming from. I guess other than that, to kind of finalize, what other ways do you feel people can start doing now at home that can kind of start preparing themselves in terms of like for therapy, where they're going to be open? I know like people talk a lot about journaling. Is there anything else that people can do?
So to hit on journaling, I think a lot of the time, and I would recommend this, and people are like, oh, that's so silly, I'm not much of a writer. And I'm like, yeah, I know, I get that. And I was, again, one of those people myself. But actually, journaling allows you to kind of process all your stuff, vent out all the heavy feelings that you're thinking about onto a piece of paper. And if you don't like writing, it doesn't need to be, you need to write out an essay about whatever it is. It just means that you can jot down a word that you're feeling, or you can even like voice, like record yourself, oh, I'm feeling like this, and my pain is really, really aggravating me today, and X, Y, and Z. So that's kind of journaling. Everyone looks at it as just, oh, I'm writing every single day. No, it doesn't need to be like that. And I think routine is a big one in terms of pain management. I think what I say by that is, people have a routine. They go into work, they do X, Y, and Z, they have that every single day. But actually, it's about noticing, right now, I'm actually really in pain, so I'm going to take a break. Putting those breaks into place, they can be a form of your routine. Not to kind of say, right, I'm going to take all these painkillers in order to feel better and I can carry on with whatever I'm doing. Because actually, you're not looking after yourself. There's no element of self-care there. You're just kind of going through, and it's difficult. It's painful physically and actually emotionally draining. So I think it's important to have breaks and notice how you're feeling within your body. Notice those body sensations. A lot of the time, we don't relate to our body sensations, and a lot of people thinking, right, what the hell is that? It's all just about, are you feeling a boiling sensation in your stomach? Are you feeling cold in your, in your shoulders? Actually notice what your body is trying to say to you, because it's a message. That's kind of the way I look at it. Are you in too much pain? Have a sit down, have a break, have tea or coffee, watch something on Netflix. Have a little nap as well. People think, right, having a nap is lazy. No, it's not. It's actually an element of self-care, Go to bed on time. Have that kind of routine where you wake up, so you have something to look forward to in the morning as well. They're very, very little things. Do something you enjoy. During lockdown, it has been difficult. People have taken on cooking, baking, etc. But do things that will make you happy. Bit of painting, try something new, experiment with different things. So these are little things that you can be doing during the day to help yourself, basically.
Nice. And I think like with journaling, like you said as well, I've been journaling the last few years, and I think initially when I started, I could barely process any of the emotions. Like I would just do like 1 or 2 lines, and I'll just stop there. I'm done for the day. But I think as you go into it more and more, it's like a habit, right? You're building it up, and as you get more and more into it, you start pouring out. So definitely good points there. Routine, definitely routine. I think a lot of clients come in, they're used to having so much pain that they don't know what they're doing, and they just go with the flow kind of thing, and kind of let pain dictate what they do.
100%. It rules your life. I mean, the 2 people that have like experienced it themselves, and I'm sure you see it in clients all the time as well, and it does take over your life. It's like, right, I'm going to sit down and I can't do this, or I can't go here, and it does take over your life. So it's about thinking, right, what can I do to actually ease this pain without taking all the medical stuff? What exercise can I do? Hence why the physio is great. You can implement those in your life, but actually it could just be that you need to vent out and explore what you're experiencing. A lot of the time, finding the right emotion to what you're going through, it's not there. It's hard. You have to really, really dig deep in order to find it. And sometimes you think you're absolutely fine. And when you tell yourself that, actually a lot of the time, you're really not. And that's okay, because we all are going through something. So yeah.
Yeah, everyone's going through something, and I guess it's you're finding a way to express it and let it go, as opposed to building it in. To finalize, where can people find you? And I know we've talked about chronic pain. Do you do any other type of therapy care?
Yeah, so in terms of what I work with, I've worked with a range of stuff. I've worked in a domestic violence kind of unit where I worked with women only, all different ages. So a lot of that work was like around abuse, basically domestic abuse, financial abuse, sexual abuse, the list goes on. A lot around, stress, so chronic pain obviously means a lot of build up of stress. So stress, anxiety, depression, just the range. I've done quite a lot of work with children as well. So, forms of art therapy and things like that. In terms of mindfulness as well is something that I always try and, fit in as tools as and when I feel like a client is ready to do that as well. So it just really depends on the client's needs. I work with a lot of relationship problems, work-related issues, bullying. And also I think the important thing here is as well, it's a lot of self-development. You could just want to come to therapy because you want to discover yourself, and people are like, what does that mean? But actually learn a bit more about yourself. Give yourself, an hour a week to actually check in with yourself. How are you doing? Where do I need to grow? I want to set goals. What goals do you want to set? So I work a lot around that as well.
So bring a lot of awareness in your life, essentially.
100%, yeah, that's the word. Just bringing self-awareness to yourself so that you can help yourself basically and support yourself in a positive and healthy way.
Nice. And you're based in Northwood, am I correct?
So I'm based in Harrow. I'm about a 5-minute walk from the station. There's also on-street parking, as well as working like in a practice. I also work online, so via Zoom, telephone appointments as well can be had. So yeah.
Nice, yeah. I said Northwood because we're also based.
Yeah, no, that's fine.
So if you want to contact Divina, go ahead. We'll be posting her details on our page. So contact her, and if you're going to R&D Physio, you can get discount. Am I correct? So you get discount to the first session.
Yeah. And I don't know what those are actually, so I'm leaving that with you.
Okay, that's fine. Yeah. So I believe it's 10% of your sessions, and if you want to do physio sessions, so Divina, then you get 50% off our first 2 sessions. So if you're interested in that, come through. And I think it's been an interesting chat. To kind of finalize, is there anything like you'd want to end with? Any kind of words of wisdom?
I think, okay, so it's been a really, really difficult and tough time for people at the minute. And it is a lot, well, that basically means a lot of time to get in touch with your emotions and what you're feeling. And also the pain management must be really, really difficult to kind of help and, actually do basically. So I think it's all about, taking your time, going with the flow, understanding what your needs are as a human being. Does that mean that you need more sleep? Does that mean you actually do need therapy on a one-to-one basis to explore your emotions, explore if there are certain elements of your life, past experiences that you haven't kind of processed or accepted in life. And also the physical aspect as well of actually going to a physiotherapist might be beneficial because there's all the physical stuff, exercises that you can do to help yourself and make a routine basically. So I think it's all about breaking the stigma and knowing that physical health and mental health are both as important as each other. Regardless of what anyone says, oh, you don't need therapy, or what's that, what does it mean? Actually, it's super important for your self-awareness, for your growth, for yourself. We live in busy cities, working life is very challenging and very difficult. Ask yourself, how are you feeling? How are you doing on a day-to-day basis? Are you doing okay? Are you struggling? Be curious. Ask yourself questions, I think is the most important thing.
Nice. Cool. So I think that's it. And then an Instagram as well. You're on Instagram?
I am on Instagram. So it's Divina Therapy, and it's spelled Divina and then therapy.
Sweet. So we'll be posting that as well on our Instagram page. So r.d.physio. So if you have any questions to finish off, if you want to ask them in the chat, just trying to check the Facebook Live now.
Cool.
A second. Cool. So, got interesting chat, amazing and such useful information. Very useful. Haven't got any questions as such.
No, that was good.
If you do have any questions, let us know and we can forward them to Divina. And yeah, I think that's it. So thank you for joining us.
No, thank you for having me. I appreciate it.
Sorry, what was that? Sorry?
No, I just said thank you for having me.
Oh, yeah, no worries. Yeah. And if anyone does have any questions, yeah, just pass them through. Thanks.
Perfect. Cool. Thank you so much.
See ya. Bye.
Bye-bye.
Cool.
Okay, we're done.